If you've been taking metformin for 5 years or longer, it's time we sit down and have a real conversation. Not a panic session, not a fear-based rant, but a grounded look at what this medication is doing to your body long term. Because while metformin is one of the most prescribed and trusted medications for type 2 diabetes in the world, it's not without side effects, especially when it's taken over an extended period. Doctors often prescribe it early on. It's effective, it helps control blood sugar, reduces insulin resistance, and even has some positive impact on weight. For many people, it's a game changer. But here's the problem. Very few people are told what to watch for after year 2, year 3, and especially year 5. So today we're going to break down exactly what happens to your body after taking metformin for 5 years or more. What should you expect? What should you monitor? What subtle symptoms might be signs of something more serious? And how do you protect yourself without ditching a medication that might still be helping? Let's start with what I consider the most underdiscussed consequence of long-term metformin use: vitamin B12 deficiency. Metformin has been shown across multiple studies to reduce your body's ability to absorb vitamin B12 in the gut. It doesn't happen overnight. In fact, most people won't even notice it in the first year or two, but over time, that slow depletion adds up, and when your B12 levels get low, your body starts sending out signals. You might feel more tired than usual, not the kind of tired that one night of sleep will fix, but the kind where you wake up groggy and never fully catch up. You might feel cloudy, like you're not quite mentally sharp. Some people describe it as brain fog, difficulty concentrating, forgetfulness, or even mood changes. Others experience physical symptoms, numbness, tingling in the hands or feet, even balance issues. All of these are possible signs of a creeping B12 deficiency, and the longer you're on metformin, the more likely it becomes. The solution here is actually pretty simple. Test, track, and supplement. Ask your doctor to check your B12 levels at least once a year. If they're low or even borderline, add a methylated B12 supplement. I personally recommend a liquid form since it absorbs more efficiently. Something in the 2,000 to 5,000 microgram range a few times a week tends to restore levels quickly and safely. But again, don't guess, test. Because B12 is water soluble, meaning excess gets flushed out, but too much for too long without checking can have its own issues. Now let's talk about your kidneys. Metformin is primarily excreted through the kidneys. That means your kidneys are doing the heavy lifting when it comes to clearing the medication from your body. And that's fine if your kidneys are healthy, but as we age, kidney function naturally declines, even in people without diabetes. And when kidney function drops below a certain threshold, metformin can begin to accumulate in the bloodstream, increasing the risk for something called lactic acidosis. Now, lactic acidosis is rare, but when it happens, it can be life-threatening. It's the kind of condition that shows up fast and doesn't give you a lot of time to react. What's more likely and more dangerous over time is the slow, silent stress metformin can put on weakened kidneys. There are some studies suggesting that prolonged use may contribute to mild kidney strain, especially in those who are dehydrated, on multiple medications, or not monitoring their lab values regularly. So how do you protect yourself? Hydration is step 1. Your kidneys rely on adequate water to function efficiently, but you also want to monitor kidney markers like creatinine, BUN, and especially eGFR, your estimated glomerular filtration rate. This number gives a picture of how well your kidneys are filtering blood. Ideally, you want it over 90. If it drops below 60, it's time for a serious conversation with your doctor about whether metformin is still safe for you. There are also supplements you can take to support kidney health while on metformin. Alpha-lipoic acid is a strong antioxidant that helps reduce inflammation and oxidative stress, two major contributors to kidney aging. Around 600 milligrams a day is a common therapeutic dose. Benfotiamine, a fat-soluble form of vitamin B1, can also be helpful, especially in people with diabetes. And a solid B-complex vitamin supports overall cellular energy and repair, which your kidneys definitely appreciate. Throw in a high-quality probiotic to support gut health, and you've got a nice stack of support for keeping your kidneys strong. Let's move on to something that often gets ignored because it doesn't always show up right away: gastrointestinal side effects. Metformin is notorious for causing nausea, bloating, gas, and diarrhea, especially in the early weeks. But what most people don't realize is that these symptoms can return years down the line. I've heard from countless people who were perfectly fine for 3, 4, 5 years on metformin, then suddenly started experiencing persistent GI distress, diarrhea that wouldn't go away, abdominal pain that seemed random, bloating that wouldn't stop no matter what they ate. It's not your imagination. Metformin changes your gut microbiome, sometimes in positive ways, sometimes not. It also increases the concentration of bile salts in the intestine, which can contribute to loose stools. Over time, this can result in chronic low-level irritation of the gut lining, leading to nutrient malabsorption and even increased food sensitivities. If this sounds like you, it might be time to ask about switching to extended-release metformin. The extended-release version releases the drug more slowly, reducing the concentration in the gut and often leading to fewer GI side effects. You can also explore herbal options like berberine or dihydroberberine. Both have blood sugar lowering effects and a much better side effect profile when it comes to digestion. In fact, dihydroberberine has become one of the go-to alternatives for people who want metformin's benefits without the bathroom emergencies. Still with me? Good, because we're just getting started. Up next, let's talk about liver health. Now, metformin isn't known as a liver-damaging drug the way some others are, but that doesn't mean your liver is immune to its effects. In certain people, especially those with fatty liver disease, a history of alcohol use, or elevated liver enzymes, long-term metformin use can quietly put stress on the liver. It may not cause overt liver damage, but it can nudge liver enzymes upward over time. And if your liver's already under pressure from diet, alcohol, medications, or metabolic stress, metformin might be just enough to push it into imbalance. So how do you know? Start by checking your liver enzyme levels. AST, ALT, ALP, and bilirubin. These are usually part of a routine metabolic panel, but if your doctor hasn't run them in a while, request it. If your numbers are even slightly elevated, ask whether metformin could be contributing. And there's more you can do to help. Milk thistle has been studied extensively for liver support. Its active ingredient, silymarin, has antioxidant and anti-inflammatory properties that can help reduce liver inflammation and support liver cell regeneration. It's been used for centuries, and modern research continues to support its safety and effectiveness, especially for people with metabolic conditions. 1,000 milligrams per day is a common dose, and it's easy to find in capsule form. The next long-term effect I want to touch on is often misunderstood, and that's peripheral neuropathy. Now here's the twist. Peripheral neuropathy can be caused by diabetes itself, but metformin can quietly make it worse. Remember the B12 deficiency we talked about earlier? Well, that's a major contributor to nerve damage. If your nerves aren't getting the nutrients they need, especially B12, B6, and certain amino acids, they can begin to misfire. You might feel tingling in your toes, burning in your feet, or numbness that makes walking feel strange. You might notice balance problems, especially at night, or a sensation that your feet are wrapped in something even when they're bare. This isn't something to brush off. Nerve damage is often progressive. The longer you ignore it, the worse it gets. And while it can be slowed or even reversed in some cases, it's much easier to prevent in the first place. So what's the plan? First, make sure you're supplementing with methylated B12 if you're taking metformin, but you also want to look at compounds that support nerve repair and reduce inflammation. Alpha lipoic acid is fantastic for this. It's one of the few supplements that's actually been shown to improve neuropathy symptoms in clinical trials. Benfotiamine helps protect against the nerve-damaging effects of high blood sugar, and L-carnitine supports energy production in nerve cells. You put all of these together, and you've got a powerful toolkit for keeping your nerves healthy and functioning. Now let's talk about something a little more subtle, the emotional and cognitive toll of long-term metformin use. There's growing research into how metformin might affect the brain. On the positive side, some studies suggest it may improve cognitive function or reduce the risk of dementia in people with type 2 diabetes. But on the flip side, long-term users have also reported increases in mental fatigue, mood swings, and difficulty with memory and focus. Could it be the B12 issue again? Maybe. Could it be the changes in gut bacteria affecting the brain-gut axis? That's possible too. What we do know is that chronic inflammation, blood sugar instability, and nutrient depletion can all impact how clearly you think and how you feel emotionally. And metformin, while helpful, doesn't always solve those problems. It might even mask them. If you've noticed changes in your mood, memory, or mental clarity over the years, don't just assume it's aging. Start with a B12 test, then look at your gut health, your sleep patterns, and your overall blood sugar control. And if you haven't already, get curious about supplements that support cognitive health. Omega-3 fatty acids, magnesium, curcumin, and adaptogenic herbs like rhodiola can all make a difference when used consistently. Now here's a question I get a lot. Can I stop taking metformin? And the answer is, it depends. For many people, metformin is a helpful tool. It's safe, inexpensive, and well studied. But if you're maintaining great blood sugar numbers, if your A1C is stable, and if you've made meaningful lifestyle changes, like improving your diet, exercising regularly, getting quality sleep, you might be able to reduce your dose or even stop taking it entirely. But don't make that call on your own. Work with your doctor, especially if you're on other medications, and consider natural alternatives that can support your transition. Berberine and Dihydroberberine are two of the most promising options. They've been shown to activate AMPK, the same metabolic pathway that metformin works through, and in some studies they perform just as well, or better, than metformin in reducing blood sugar, improving cholesterol, and reducing inflammation. Plus, they don't have the same GI side effects. Dihydroberberine in particular is a game changer. It's the more bioavailable form of berberine, meaning your body can use it more efficiently with less stress on the gut, and many people report fewer side effects, better absorption, and more stable results. If you're thinking about weaning off metformin, this is where to start, but again, do it with support, track your numbers, make changes gradually, and make sure you're supporting your body with the right nutrients, the right foods, and the right habits. Because the truth is, long-term health isn't about being on or off a drug, it's about balance. It's about knowing what your body needs, adjusting as you age, and refusing to settle for feeling just okay. Don't let the convenience of a prescription stop you from taking ownership of your health. Don't assume that because you've been on metformin for 5 years, you need to be on it forever. And don't wait until symptoms become serious to act. You deserve to feel vibrant. You deserve to have energy, mental clarity, strong digestion, and a healthy body that works with you, not against you. And that starts with knowledge. The more you know about how metformin works, what it depletes, and how to offset its long-term effects, the more power you have to stay ahead of complications and truly thrive. Let this video be your sign to check in with your doctor, look over your recent labs, assess your symptoms, and ask better questions. Because 5 years on metformin doesn't have to mean 5 years of hidden side effects. It can be 5 years of proactive health, clear direction, and total control over what comes next. You've got this.